Hi, I'm Dr. Errol Chan, Medical Director and Consultant Ophthalmologist at Ascend Eye Clinic, Farrer Park Medical Center. I see adults and children with a broad variety of eye conditions. Specifically, my clinical and surgical interests are in cataract surgery, retinal surgery, glaucoma surgery, and laser vision correction. So currently, there are a wide variety of lens implants that patients can potentially choose from during cataract surgery. Individuals' visual needs are much more complex now. There is a much greater reliance on the need for good vision, particularly near vision. So the different implants are able to help individuals cater to a wide variety of different lifestyle needs as well as their visual preferences. For example, for trifocal implants, the newer trifocal implants compared to the ones previously give much less visual aberrations of glare and halos. For individuals who were previously excluded from the use of trifocal implants, such as patients with glaucoma or diabetes or other macular conditions in the eye, there is now the option of extended range implants, which can help these individuals have good vision for near, even without glasses. The choice of the right lens implant for the specific individual is arrived at after a detailed and meticulous evaluation by the individual's eye specialist. The factors that we would consider include the specific medical status of the eye, the patient's current spectacle refraction, patient's preferences for spectacle independence, and also the patient's activity profile and lifestyle needs. So to give you two very extreme illustrative examples, first would be an individual who is much older, in their 70s or 80s, spends most of their time at home, occasionally watching television, and may not necessarily read the newspaper very often. In such an individual, having monofocal lens implants which give good vision for distance would be sufficient to meet this patient's expectations. However, we are finding that patients are developing cataracts in their early age, for example, around the ages of late 40s to even 50s. So such individuals are still actively in the workforce. They still require good use of their eyes for computers and for phones. In our modern and fast-paced society, a lot of individuals are very much dependent on their phones or their tablets for their day-to-day life. And therefore, having spectacle independence for such activities is a very critical part of the discussion that we have as eye specialists and the patient. In these patients, lenses such as trifocal or multifocal lenses or extended range lenses would facilitate their independence from spectacles and give them a much better quality of life in their day-to-day work. So a common question that I get asked is, if I have dry eyes before cataract surgery, will it get worse after surgery? Now, it's very important that before cataract surgery, any form of dry eye is optimally managed. So we would preoperatively make sure that the patient is on good quality lubricants, in fact, medications to improve the quality of the tear film prior to cataract surgery, so that after surgery, the recovery from the surgery is much more quick. Now, it is true that with cataract surgery, there is a transient period where the eye is a bit dry after surgery. All individuals having a transient period of dry eye after surgery will recover with appropriate treatment. However, those patients where the dry eye is more optimally managed before surgery will recover much more quickly. Dry eye in itself may contribute to slightly reduced vision after surgery, and so therefore it is important that we treat dry eye well before as well as after the cataract surgery operation. So the earlier versions of multifocal lens implants, particularly the bifocal lens implants, were known for having significant glare and halos. However, the newer technology of multifocal lens implants, particularly the trifocal implants that we use nowadays, have much less glare and halos than their older counterparts. Glare and halos are noticed by individuals with multifocal lenses only under specific conditions. For example, they are not seen during the day at all. Under dim conditions such as driving at night, individuals with multifocal lens implants may notice spreading of light or rings around lights around point sources of light, such as traffic lights, street lights, or car headlights. For example, in a cinema, individuals with multifocal lens implants may notice glare and halos from the floor lights, but they would not notice any glare and halos from the movie on the screen. From our experience, patients who have had multifocal lens implants, including commercial drivers, are able to adapt after a fairly short period of time, and this does not impair their ability to drive confidently and safely at night. So for patients who don't mind wearing spectacles or contact lenses after cataract surgery, the traditional approach would be to do monofocal lens implants in both eyes, so that will give them good distance vision, and for near, the patients would then resort to wearing reading glasses. However, there are patients who have a preference for not wearing glasses after cataract surgery, and so there are several approaches that we can help them. The traditional approach has been to do monovision, which is to target one eye for distance using a monofocal lens implant, and to target the other eye for near using a monofocal lens implant. Individually, this gives good vision for distance or near. The individual has to toggle between both eyes and be able to adapt to this configuration. Oftentimes, this causes a few issues such as the loss of depth perception, and also requires a period of adaptation. The other approaches for helping individuals not use glasses after cataract surgery include the use of premium lenses such as multifocal lenses and extended range lenses. If you have any visual symptoms and are considering cataract surgery, speak to an eye specialist to discuss the various lens implant options suitable for you.